Thank you for tuning in today. We have an interesting episode that I think you will find enjoyable. Today, I'm interviewing Dr. Joel Pash. He is the co-founder of the UpSize Clinic. UpSize is a clinic that specializes in penis enlargement using dermal fillers. So welcome to the show, Dr. Pash.
Thank you for having me.
So what you're telling me is that size really does matter?
I think it does. Y-
What is the average size, penis size?
Um, so if we're talking about flaccid, it's probably about 4 inches in length, 4 inches in circumference. Now that's not square, right? Like it's not like a square penis. Like circumference is, people have to recognize that it's misleading a little bit. And then erect is probably 5 inches and 5 inches around, maybe 5.5. Of course, means it's different in everyone.
Yeah. So the guys that are coming in to see you that want to have this enhancement done, what type of sizes are you typically seeing with them? Are you like, oh yes, you definitely need it, or are you trying to talk some guys into like, I don't know, you're pretty good with the size that you have?
It's rare that I try to talk someone into that the size they have is fine. Even though, I mean, that's not to say that it's not fine, but people are not necessarily coming to us because they have a small penis. Everyone thinks they have a small penis, but most people are just fine. It's usually the average patient is just like they want to have more fun, or it's, the same reason that, women would get cosmetic surgery or say filler in their face or whatever. Usually it's not because you have like a problem. It's just that you want
Yeah,
to
I was
enhance something.
curious if you ever had to address like psychological issues or society pressures with the patient. Do you ever have to talk about that with them?
No, so we are really enhancing what people already have. As you probably know, we're a non-surgical procedure, so it's injection of dermal filler. Given that, if you have like a penis that is so small that it's not functional, for example, or that it's actually a medical problem, there's probably not anything that we can really do to help. So, like that would be a reconstructive surgery problem. So we really are just enhancing what's normal. Now, within normal, there's like a 3 inch penis is technically normal, and a 7 inch one is. Like I said, though, everyone thinks that they need it to be a little bit bigger. So even the 7 inch guys come in and they think it's small, and they have a problem. So
Well, so tell me a little bit about the procedure. How do you do it?
yeah,
How long does it take?
yeah. So it takes about anywhere from 30 minutes to an hour. We're injecting dermal filler, so it can increase the thickness of the penis and like some maybe slight flaccid length increase. Um, it's done in a procedure room under sterile conditions. It basically we do numbing, we mark the area, and dermal filler is injected circumferentially. And the goal is a good cosmetic outcome so that everything looks even and natural. It's very safe. There's not really much pain because everything's numbed quite well. And it's a very straightforward procedure.
Are you injecting it with a cannula like you see med spas inject fillers into the face?
Yeah, usually we use a cannula. It depends on anatomy and skin type and all that. I I would say 80% cannula, 20% needle. A needle has its benefits and a cannula has other benefits. So, it just really depends. But we find that people that have, like, kind of younger people with thicker skin tend to do better with the cannulas, and people that are maybe a little bit older with thinner skin, the needle actually tends to cause less trauma.
So tell me more about the injection technique because I'm sure guys are thinking, how many injections is this? Does it hurt? How am I sitting? All of those things that they're wondering.
Yeah, so the procedure is done supine, so they're lying down on a procedure table. The amount of injections is largely dependent on the length of your penis, not your penis, but a man's penis.
Yeah.
And
I don't have a
um,
penis. I just have big balls.
okay, good. Can't do anything to those. Um, so like a needle or a cannula is typically 1.25 to 1.5 inches in length. So if you have a 5-inch penis, you're probably looking at three injection sites lined up, right? Like three in a row would be 4.5 inches if you have a 1.5 inch needle. So and then we inject on both sides. So about 6 injection sites. Realistically, the numbing that we do um, hurts for a few seconds and no one feels anything after that.
Are you doing a pelvic block?
No, there are some doctors that will do penile blocks, which is, I think, what you're referring to.
Yeah.
The Actually, we just numb the skin, and that actually works a little bit better, is less uncomfortable. Nerve blocks in general are not always effective and can need to be repeated and stuff. That's why when you go to the dentist, for example, and you keep feeling pain, that's because they did a blind nerve block and they basically missed the nerve. So
Yeah.
if you numb the actual area, then you don't have any chance of missing.
So you're not using a topical. You're injecting, like a lidocaine into the penis prior to the procedure.
Yeah, and when you say into the penis, just to clarify, it's in the skin of the
Yeah.
penis. It's not like
Yeah.
into the penis.
Yeah. Like a
And
superficial injection.
yeah, you can use topical, and sometimes we do, but it's honestly not really necessary. Um, Putting topical on takes 30, 45 minutes for it to do anything, and then even still, it's just kind of minor difference. And like I said, the pain that you feel when you inject lidocaine lasts for a few seconds. So putting on topical anesthesia, waiting for 45 minutes to get rid of 1 second of pain is not always
Yeah.
worth it.
Yeah. So obviously filler doesn't, well, at least to my knowledge, I don't know, maybe you're going to tell me differently. It doesn't expand and contract. So when the penis is flaccid after you place this filler, it's bigger when it's flaccid too, not just when it's erect.
Yeah, so you're correct that the filler per se does not expand and contract. Like if you have a formed bit of filler, say it was in a chunk of filler, it would not expand and contract. But the filler does get integrated into the tissue, so there's some amount of solid filler there, but there's some amount of just integrated filler into the structure of the tissue itself, so that when the penis expands, some of it does expand.
Okay.
The reason, though, that you do get a little bit of flaccid length is what I think you were alluding to. If we inject it when the penis is flaccid, or if we inject it when the penis is like somewhere in between flaccid and erect, which is typically the case, and you put enough filler in, then it becomes difficult for the penis to be able to shrink smaller than the structure of the filler.
Yeah.
So you get like almost like a scaffolding effect where it because there's like scaffolding there, it can't shrink to smaller than that.
Does that feel weird? Different for you guys?
Um, I don't think it feels weird. I don't hear about a difference in sensation or feeling, except for the fact that guys will actually say that their penis is heavier after because it is.
Yeah.
But I think it's something guys get used to.
Like how many syringes of filler are going in there?
Um, I would say anywhere from 6 to 25.
Oh, wow. Holy cow.
Um, the most I've done at one time is about 25. The least is one, obviously, but one,
So I was curious, like, can you max out? Like, there's only so much you can put in there. I mean, 25 is a lot
uh,
of syringes.
I don't think there's a maximum over time. I have one guy that's had probably 90 milliliters of filler.
How big is his
So
penis?
if
I need to know.
it's Coke can. Like he sent me he sent me a picture of it next to a Coke can, and it's bigger than the can.
Stop.
Thicker than the can.
And wait, and
So,
how many syringes did you say? 90?
he's probably had like 90 or so. A
What,
lot.
like, does he have an interesting profession, or this is
Yes.
okay?
He has a profession where having a Coke can comes in handy. If, I'm not sure how much we can elaborate on that, but viewers can use their
Yeah,
imagination.
okay. So when you're placing the filler, are you do men, I'm guessing they can maybe choose here. Do they want it smooth, or are you trying to get it smooth, or do people sometimes want it like more rigid, so it's like a different appearance, or more like girth like? Tell me about that.
I've Interestingly, I've never had anyone ask me to do that, but I've had many podcasters ask me that question that you just asked me. So I'm not sure.
What does that say
Uh,
about us? I'm not
I
sure.
know exactly. Like I'm not sure what all you guys are thinking, but no patient has ever asked me for that.
Okay. I'm sure you got some interesting stories.
I have tons of interesting
Because not
stories.
to derail our podcast, but I'm like, wait a minute. Now that you just told me about the guy with the Coke bottle, I'm curious to know more. So give me one of your more interesting patient stories that you can share that you're like it stands out in your mind.
Um, every Honestly, almost every single patient I have has some sort of crazy story. The guy with the 90 milliliters of filler is, like you said, he's in a career where that amount of filler is beneficial to him. Um, he came in one day with he wanted to show me that he uses this pump to make it bigger, and he wanted to like demonstrate to me how it was going to work with the filler or something like that. And he took the pump out, and the penis, like the head, didn't even like couldn't even get in like the entry point of. So I mean, I have so many stories, but that's the first thing that comes to mind.
So
Yeah.
I guess so. Can patients still use a pump with the filler? It doesn't
N-
like break it down quicker.
You can. I mean, it has to fit through the opening, like which in
let's
his
just
case
say
it didn't.
let's just
Let's assume
say
it does.
yeah. Let's just
Yeah.
say the patients that don't have the Coke can. Okay.
I tell them not to use it for about a month just to
Okay.
make sure that the filler is all solidified, and the filler, by the way, is solidified in 3 to 5 days, but it's always solidifying more. So the 1 month mark is when I'm pretty confident that it's there to stay.
What about intercourse? How long?
7 days, and you technically could have intercourse right away. Um, it wouldn't harm the filler in any way. We're just trying to prevent infection, and you have patients have like six, like I said, anywhere from 2 to 6 holes there. They heal quite quickly because we use a 25 gauge needle or cannula, but still, waiting a week kind of guarantees those holes are healed, and
It,
in that case, there's no chance for infection.
is there significant bruising?
Um, there can be, but it differs in everyone. It can be anywhere from the next day, like it's like nothing happened at all, to bruising that lasts 2 weeks. I've never had anyone, I've probably done six, seven, 800 of these. I've never had anyone call me and say they have too much pain, can they have pain medications, or like no one's even asked me if they can take Advil or something like that. So to the extent that there is bruising, it's not horrible.
Well, I guess since we're on the topic, side effects.
Um, any medical procedure has side effects. As far as this goes, if you compare it to surgery, it's got far less side effects. So when you say side effects, I'm assuming you mean potential for complications.
Yes.
Uh, Injectable procedures have a chance of infection, although rare. Needle going in anything in your body has chance of damaging structures like blood vessels, nerves, more important things like the urethra or the corpus cavernosum. Having said that, we don't put the needle or cannula anywhere near any of those things. So I've never had any complications, nor do I really know anyone that's had any serious complications. I have seen a couple minor infections that got improved with antibiotics over a few days. So, you know, does it have, can it have complications? Yes, like anything can, but it's very uncommon. Surgery, on the other hand, can have all kinds of things that
Yeah.
are actually fairly likely.
Yeah. Um, do people undergo, and this might be a silly question, but would people undergo a penile implant purely for size? Like, would a surgeon do that?
Implants actually will decrease your size. They it's they'll give you an erection, but
Yeah, because that's the only time
you
we
get
refer out for them is for our severest ED patients.
yeah. So it's very common for patients that have implants put in to actually complain of a decrease of length
Yeah.
afterwards, and it's just because basically scar tissue develops and everything shrinks up. Same thing if you have like a prostatectomy, they also get shrinkage. So no, you wouldn't do it for that. There are procedures out there where they'll implant silicone sleeves in the penis, like in the same area where we're putting filler. They would actually insert a silicone sleeve or a dermal graft sleeve, like it's called like alloderm or something like that. They what from what I've seen at least, have horrible complications and side effects. It doesn't make your penis shorter, and it probably does make it a little bit thicker, but they don't look very natural, and they have possibility because they have to deglove the penis to put them in. So for listeners, what that means is cut the skin on your penis, completely peel it all back so that there's no skin on your penis. Like put this implant in and then pull the skin back over it and sew it up. So you can get all kinds of nerve damage and sensitivity stuff and scar tissue can make your penis shorter and thinner. And then they have erectile dysfunction because they can't feel it. So those are actually implants that are designed for thickness. But I've seen just only bad things with them. Our injections do essentially the same thing, but it's just they're injected through little tiny holes, so we don't see any of those complications.
So, what do men report back with intercourse? That it feels the exact same, or is there anything that they report back?
Yeah, it they don't have any change in sensation per se. So I've never heard that. On what I have heard that's positive is that it's everything's tighter, right? So the partner feels more and they feel more because it's taking up more of the space.
Do you ever have partners come in together?
Yeah, oh yeah, I've seen all kinds of stuff. I've had um, everywhere from I've had people, not that it's a partner, but you wanted stories. Like I've had
Yeah.
people come in with their dad, with their mom.
What?
I've had,
Really?
yeah, with
That was
their, yeah, I had a guy come in with his dad. His dad was paying for it. And
oh.
I had a 19-year-old come in with his mom who was also paying for it. Um,
And would you say
I,
those in those situations, those patients' penis was just like average size, like it wasn't like a micro, like you were able to help? Did you feel like it was necessary for the child to be there with their parent? I guess is what I'm
I don't want to call him a
trying to.
child. He was
Or
19.
teeny,
So
teenage.
I think,
Well,
yeah, uh, he was in college or whatever. No, he was fine actually. He just and this is common. He had done some research on it and he went down this penis filler rabbit hole probably by the sounds of things and he just decided he wanted to get this done.
I guess
And
it's no different. You see young women getting breast implants all the time. Plenty of 19-year-olds running around with those.
Right. Or lip filler or whatever, right? You
Yeah.
see it on social media or
Yeah.
whatever. No, it's not, there's nothing abnormal about a 19-year-old getting it. It's less common that a 19-year-old can afford it. And in this case, he brought his mom in to pay for it. I mean, he must have had a cool mom because I would have, even if my mom would have paid for that, which she wouldn't have, there's no way I would have.
Yeah. How does that conversation go at the dinner table?
Yeah, I can't imagine.
So how much is the procedure?
Um, it is the lowest price it is about $4,200, and the highest price is kind of unlimited, but practically speaking, maybe $13,000. The reason I say unlimited is because if you get 90 milliliters put
Yeah. I
in,
was gonna say
then
90
obviously
syringes.
that could get right. 90 syringes is a lot of syringes.
Yeah.
Um, where we charge based on the amount of milliliters that we put in. Roughly the price of that ranges from like high 500s to about 700. It's discounted the more you get. So like 6 milliliters of filler is about $4,200, and the average person gets about 10 to 12 milliliters, which is roughly like $6,500 to $7,500.
How long does it typically last?
Um, it's very different in everyone. I think on average 2 years. There's guys that I've seen 3 years later that have it. And there's guys a year later don't have very much left,
So,
but
so like the
but
guy that
few.
has 90, is he doing that all in one setting, or is he doing that over the course of several months, years?
Oh, he's come and seen me many, many times. Um, the most he's gotten at one time is probably 20 or something, maybe or 25. Saying that he's got 25 at once, and then the amount of times he's come, I think he might have more than 90.
Yeah. Oh, wow. What are some of the biggest misconceptions that you encounter with what you do?
You know, from a medical standpoint, I've okay, so backing up a bit, misconception number one is that it's like only weird people get this done or something like that. And that's a misconception by obviously not by patients, but by people that you talk to, right?
Yeah.
And everyone that comes in my office, well, not everyone, but like most people that come in my office are totally normal and people that your listeners would likely hang out with and probably even know lots of them. Like I have dentists and lawyers and doctors and pediatricians and everyone, right? So it's like
Yeah.
you might very well know someone that's the last and teachers and whatever, right? Like so people that have this done, and so it's not weird. That's misconception number one. And then within the medical field, there's doctors like that I work with, like other doctors, because I'm also an anesthesiologist, and they have this perception that it's like a weird thing for doctors to do, right? Like, why would a doctor get in the dick enlargement business? And what I'll tell doctors is we're actually making people's lives better, right? We're making them happier. Everyone that leaves the office has a big smile on their face. It's way easier than they thought it was going to be. And 99% of people, not to say it's life changing, but they're happy with themselves and they're happy they got it done. And
Well, why should
um,
this be taboo if making women's breast larger isn't, or even
exactly,
smaller?
like,
I mean,
yeah, I mean, and it's funny enough you mentioned that. I had a plastic surgeon that I was working with in the operating room say, how could you finish medical school and do anesthesiology residency and then go into this? Like, as if, like, to demean me that this was like something crazy that I was doing. And I didn't even think to say that, but yeah, it's a valid point, right? Well, it's like you did a whole residency to make people's breasts
yeah,
better, right?
yeah. So yeah, it's just interesting that that's been like socially normal now, but but this is still like a conversation that most people wouldn't share with their friends that they had done. How many locations do you have?
Um, Last I checked, 14, I think.
14.
And we
And
have a bunch more coming online all the
okay,
time.
okay, so are they like standalone locations, or this is like something that somebody like trains under you and learns how to do it and then they offer it at their clinic?
Yeah, what we do is well, so number one, I have my own clinic. I have two of my own clinics that I personally work out of, and those two clinics only do penis enlargement with dermal filler. That's it. But the most of our doctors have trained from either I've trained them or Dr. Friedlander, who's another founder, has trained them, or both of us have, and they've integrated this procedure into their existing practice. So, like, we have other surgeons have that do this, or dermatologists or plastic surgeons. We have interventional radiologists, so all kinds of different types of doctors that have incorporated this. Many of those doctors own med spas, so work out of there.
Okay. So where do you think the future of penis enlargement is heading? Is there anything that you're excited about for the future, or anything that's like coming down the pipeline that you think could be a game changer for this business?
Well, I hope that we will be a game changer for this business. I think I definitely see momentum in the sense that 3 years ago I'd never heard of this, and then I started the business, and it's not only that I've heard of it because I do it, but there's other practices out there that are starting to do this, and we get lots of phone calls asking for training, or emails or text messages or whatever. So I suspect that in the next several years, this will become more mainstream, and you'll see many different physicians, nurses, um, physician assistants, et cetera, offering this in their practice. What I will say is that when you do start seeing that, um, listeners should keep in mind that part of the thing that makes this that makes good results is experience doing it. And as you know, having a med spa, when you offer like a million different things, sometimes you're not good at any of them.
Yeah.
So for the listeners, especially when this does become more common and you see everyone doing it, just always ask, and for any procedure, ask how many procedures your
Yeah.
provider has done.
Yeah, I was gonna ask that question, like some red flags or some things for people to be looking out for, because just like people leaving the country to go have plastic surgery, isn't always a great idea. The Brazilian butt lifts, you hear about, or the cheaper implants. I'm sure you see that with what these offerings as well. So making sure you're choosing the right provider is going to be
Yeah,
key.
I think any in medicine in general, like it doesn't matter if you're having brain surgery, a C-section, probably guys aren't going to have a C-section, although anything's possible nowadays. But what whether you're having a penis enlargement or a knee replacement or anything, um, ask how many your doctor's done, and what,
Yeah.
if they've had complications and success, and because that's a big thing. Anyone can say that they do anything if they're a doctor or an NP or a PA, but you want to make sure they're experienced.
Yeah.
Other things to watch out for is in surgery, and surgery in general on your penis, I think is a bad idea. The surgeries that exist are not as established as surgeries, for example, breast implants. So the number of these that have been done are like orders of magnitude less than the amount of breast implants that have been done in the history of the world. And so, because of that, there's a lot more complications, I think.
Yeah.
Beware of surgery. So, and then beware of like non-doctors injecting stuff in your penis. Like, I've heard of all kinds of crazy stuff, be it a non-doctor doing the procedure, or injecting something in there that should not be injected in there.
How do you advertise to get your patients?
Most of our advertising is done on Google,
Okay.
so it's just search advertising.
Okay.
Um, in the past, we've advertised on radio. Uh, we have ads on Grinder, Tinder, and those kind of things don't let us advertise on them, but Grinder does.
Yeah.
So
I was
we
gonna
do
say
that.
it's a tough marketing market, I guess, for some of those keywords. I know because I even our stuff gets flagged on a regular basis, so I can
We were on
imagine.
Facebook for about a day, and then we got that was like right when we started, and I think I'm permanently banned
Yeah.
from Facebook. And it wasn't even a risque ad, but it's just, yeah, like you said, it can be
Yes.
very hard.
Yes.
Google's quite reasonable as long as you advertise the truth and don't do anything misleading, then
Yeah.
they're pretty lenient.
Okay. Well, where can people find you or learn more? Do you want to give us your social media information or website?
Yeah, website is upsizematters.com. Um, we will put we have a Twitter account and Instagram and Facebook, and we'll put those in the description because I don't want to get it wrong.
Yeah,
So, but
I'll attach all this in the
okay.
show notes for people to. Do you have any on YouTube? I like any demonstrations with patients or
So YouTube actually is one of the things that we can't post on.
Okay.
Um, there's if you go to our website, upsizematters.com, there's a page on kind of in the media, and likely this interview will end up on there. And there's all kinds of other interviews and um, videos and stuff like that
Okay.
that viewers can watch.
Okay. Well, awesome. Dr. Pash, thank you for being on today. I appreciate your time.
Thank you for having me.
Thank you.